Brought to you by GTA, your island, your network.
It was Dr. Kozue Shimabukuro's testimony that set the tone. She presented slide after slide describing management failures and an intolerance for any criticism. She is relatively new to GMH and says she is now paying for trying to make things better.
As I became more and more vocal about expressing my difference in my opinions over their inefficient way of running the hospital, the tension and the hostility became tangible. I hated going to work because of it every day, because I knew the hostile environment waited for me.
In January, a joint accrediting commission issued a report that threatens to revoke accreditation. In an oversight hearing, management downplayed the findings, blaming chronic budget shortfalls. GMH and Adelup also stepped up public lobbying for a new sales tax as a dedicated funding source to fix the money woes. But Shimabukuro charges that they deliberately misled senators and management conspired to keep her from public meetings as a way to silence her.
The majority of joint citation was clearly due to leadership issues, and we were not going to be able to hide it. The public deserves to know that. They lied to keep me away, because I told them multiple times, if you guys ask me that questions about Joint Commission, I said I would say what I just said. It is a failure of leadership.
She claims there are deficiencies that could otherwise raise or save money. Some simple, like the lack of coordination over food costs at the cafeteria. Others are multi-million-dollar revenue losses, such as doctors not held accountable for timely charting of procedures.
Insurance company denies any claims after certain times, 90 days, and for Medicaid 1 year. And that's why this delinquent chart, aged chart equals lost revenues. In the States, we never let that happen, never. To the point that we hold the physicians accountable and then suspend their privileges until they complete it within a few days. That is not happening at GMH.
Her estimate of $22 million in non-billings, raising eyebrows among senators who will decide soon whether to go forward with the sales tax. Shimabukuro is not alone. Longtime surgeon Dr. Jerome Landstrom also charged that GMH is run through shadow politics and obscured finances. For example, he says GMH is not billing properly for surgeries.
The facility fee is the lion's share of that. Okay? The daily rate, the OR time, ICU, emergency room, it's a huge number.
He also describes a long-standing systemic mess where physician contracts are handed out through political favoritism and nepotism. Oversight Chairman Senator Dennis Rodriguez.
We really do have to get to the bottom of all these allegations. We can't just let it go, linger out there. Dr. Landstrom says something very interesting, in which I believe that it's a systemic problem.
Rodriguez commissioned a comprehensive study of decades-old problems at the hospital, but it went nowhere.
I felt it was my opinion that you got to take politics out of the hospital. Take the way we've been doing things out, because it doesn't work.
An oversight hearing is scheduled for June 18. For Guam's News Network, I'm Nestor Lecanto.
The committee will conclude.
Brought to you by GTA, your island, your network.